Hello and welcome to this video. My name's Chris and this is part 3 of 3 of my pregnancy series. In part 1 we covered you're pregnant, congratulations, but now what? Kind of an overview of the first and part of the second and third trimesters and what to expect. In part 2 I covered the 7 things that I hope all of my pregnant patients know when they walk out of their first, if not second, consultation with me. And today in part 3, we'll be covering the most common discomforts in pregnancy and how to mitigate them. As always, this is general advice and I can't give specific advice over the internet, but if you're interested, please keep watching. The first and most dreaded sign or symptom of pregnancy that I'll be talking about is the absolutely feared morning sickness. Now, morning sickness, it's a really bad name because it can occur at any time of day and for some people all day, every day. It's also very common in the first trimester, but don't be fooled. Some people can have morning sickness throughout the whole pregnancy. Yikes. Before trialing medications, we often suggest to patients that you try eating very small meals, bland things like crackers without spices or cheeses or anything that might upset your stomach. Avoid having an empty stomach. Reducing the amount of caffeine that you're drinking and avoiding spicy foods and things that may set you off, and keeping up your fluids, whether that be plain water, juices, icy poles, jellies, essentially anything that keeps you hydrated and gives you some much needed fluid and electrolytes and sugar. Outside of the food realm, I also suggest avoiding quick movements like jumping out of bed or jumping in and out of the bath or shower, as this can initiate nausea. Ginger has also been found to be very helpful, so things like ginger ale and ginger tea and ginger biscuits may also be very, very helpful. I'd like to highlight that a very small percentage of women suffer with what's called hyperemesis gravidum or gravidarum, not quite sure how it's actually pronounced, which is an intense, prolonged and protracted vomiting in pregnancy. If you suspect this is you, please do chat to your doctor or midwife ASAP, as it can lead to significant dehydration and we want to replenish this as soon as we can. If despite all of these simple measures, your nausea and or vomiting is still super bad and impacting your day-to-day function, please do chat to your healthcare provider, as there are medications that are safe in pregnancy that may be very suitable for you to help you get through it. We're going to stay on the gastro theme for a while because the second most common sign or symptom in pregnancy that causes discomfort is constipation. This is because of a couple of reasons. First and foremost, it's the hormonal changes in the body slowing down the gastric system, but also, especially in the third trimester, the physical changes because you've got something growing there on top of the bowels and it can slow everything down. Just like for my non-pregnant folk, my suggestions include keeping up the fluids, increasing fiber in your diet and supplementing with such things like a psyllium husk or other pregnancy safe is the important part there, types of fiber. So check the labels and check with your healthcare team. Ensuring you're getting enough fruits and vegetables in your diet, moving, so exercising and getting enough sleep. So basically just looking after yourself can help prevent or reduce constipation. But again, it's super common, so it's not like you're doing anything wrong if you get constipated in pregnancy. If despite all of that you are still constipated and it's driving you bananas, please do chat with your healthcare team, as there are things we can do to help that I haven't listed, but are medications and are very specific to your healthcare need. Again, with the gastro things, some pregnant people say that they get food cravings and some say they get food aversions. That is, they want to avoid foods at all cost. Try to honor your cravings if you can. Unless you get something called pica, which is where you crave non-food items such as ice or clay or sand. If that's you, chat to your healthcare provider, which is basically just the theme of this video, but it can indicate an underlying deficiency or it can just be pregnancy, and we'll do what we can to help. If you are honoring your cravings and eating all the things that you're craving, please do also try to keep a healthy, balanced diet, because for some people they crave really sweet things and it is not good for you or your developing baby if all you're eating is ice cream, for example. But again, if that's all you can stomach and tolerate, that's okay too. Just let your healthcare team know. Heartburn also comes hand in hand with pregnancy, and similarly to constipation, it's because of two main things. One is the hormones that are in the body when you're pregnant, and also the fact that you've got something that's changing the location of all of your organs and increasing the pressure in the abdomen, which increases the laxity of the valve that stops the stomach acid from coming up normally. Just like with the nausea, we suggest eating small, frequent, bland meals, trying to sleep more upright with 1 or 2 extra pillows, or sometimes even a recliner if you're so inclined. And if all else fails, you may be prescribed an antacid by your healthcare team. We're finally moving on from the food-related stuff, and the next thing that is very common in pregnancy are swellings, especially of the hands and feet. In pregnancy, you actually have more blood circulating than you do when you're not pregnant, and it's not all bubs, blood, and fluid either. It's actually the pregnant person's blood supply increases in pregnancy, which is super cool, but that fluid has to go somewhere. If you are getting particularly swollen ankles, hands, feet, try and avoid prolonged standing. Try and wear compression stockings or supportive stockings. Rest with your feet up regularly and do wear comfortable shoes. That being said, it's really important that you let your healthcare team know that you're experiencing swelling, because sometimes the swelling can indicate that there may be an underlying problem. Not to scare anyone, but there is a condition called preeclampsia, which is where the blood pressure goes really, really high and can precipitate seizures in some instances. And sometimes one of the very first signs is increased swelling and headaches and a whole host of other things. But long story short, if you've got swelling and it's not just mild, it's actually quite significant, or you just concerned, let your healthcare team know. Skin changes are also very common, from simple things like stretch marks for obvious reasons, stretching skin, to itching, to chlasma or melasma, which is the discoloration or brown spotting that's very common on the face, hence why I just touched my face. And also changes to the color of your skin in other areas, such as your areola, your axilla or armpits, your groin, your belly button. Some people get a linea alba, which is the line in the middle of their stomach in pregnancy. Frequent moisturizing can help a lot with things like itch and stretch marks and whatnot. And most commonly, the pigmentation changes do revert back to essentially normal after pregnancy. As is the theme of this video though, if you're itching in particular, and itching quite a lot, it may be a sign of something else, such as cholestasis of pregnancy or too much bile salts leaking into the bloodstream. So do chat to your healthcare providers. We're very, very good at figuring out if things are within the realm of normal or not. And finally, another very common discomfort in pregnancy is changes to your mental health. If you watched my last video, you kind of know the spiel already, but because of the racing hormones, the societal changes, the familial changes, the body changes, all of the changes, it's not uncommon for pregnant people to feel that they have a perinatal anxiety or depression. That being said, it's really important to chat to your loved ones, your partners, and your healthcare team about your mental health, as if you are experiencing perinatal anxiety and or depression, it's important that we can put interventions in early to avoid it impacting you, your pregnancy, your family, and becoming anything more serious. Outside of your healthcare team, you can also access Panda, which is an online website or a phone line that you can call to discuss your mental health. And that's it, guys. That's my 3 videos on pregnancy. I hope you enjoyed it. Let me know what you want to cover next. Don't forget to subscribe, like, that's this one, over and over again. And until next time, guys, stay safe, stay healthy, and I will see you in a video very soon. Bye now.